So now that we know a little bit more about the pelvic floor, gonna be honest, here comes the tricky part, that we want to coordinate the pelvic floor with your deep core. So we're going to talk more about that core canister and how it all works together. Why this gets tricky is that most of the time, if someone has had any introduction to the pelvic floor, all they've been taught about it is how to do a Kegel exercise, which, as we know from the last slides, is a contraction of the pelvic floor muscles. But they haven't been taught anything about how these muscles work together with the rest of the muscles in the core canister and what's the best way to get them to coordinate together. And that's what we're going to do next. So let's review that core canister. We've got the diaphragm at the top of the canister, the pelvic floor at the bottom of the canister, the transverse abdominal muscles, and the deep back muscles, the multifidi, that form the sides of the canister. And we want our canister working well together. So we're going to start with the diaphragm up top here and see what happens when it's doing its job. So our diaphragm is our muscle that helps us breathe, especially when we take big, deep breaths. So when we take a big, deep inhale, our diaphragm's going to drop down, and then our belly should expand out and our pelvic floor should expand out. I want you to think of yourself as a balloon that as you inhale, that balloon is filling with air. So everything expands out because we're filling up like a balloon. When we exhale, we are deflating our own balloon, okay? So when we exhale, the diaphragm goes back up and the belly and the pelvic floor recoil back in. It's like the air deflating out of the balloon. So inhale, we fill up our trunk balloon. Exhale, we deflate the trunk balloon. So we're going to practice this so that you can kind of feel that movement and how it should be happening, because many people honestly don't do deep breathing very well, and they don't get good movement of the diaphragm and the abdominal and pelvic floor muscles when they breathe. And this should be happening. So to practice this, I want you to place one hand on your upper chest and one hand down low on your belly. And I want you to take a big, slow, deep breath. And if you're doing this correctly, you should feel the hand on your belly move more than the hand on your upper chest. So we take a big, slow inhale and exhale. And I feel my lower hand moving much more than my upper hand. If I can't take a big deep breath, if you feel like you can only go and you run out of air, and see how my shoulders went up, you're not letting your diaphragm go down. You're not letting things be relaxed. So if you can't feel the hand on your belly moving out more than the hand on your upper chest moving, you might want to go try this in a laying down position where you're more relaxed and supported, and that might get easier and you can feel it more. Now, to make it even more challenging, or if you feel like you've got that movement, see if you can feel what happens with your pelvic floor. So remember, as we inhale, the belly should expand and the pelvic floor should drop down. So if you're sitting in a chair, you might feel the pelvic floor gently push into the chair a little bit as we inhale. And as we exhale, you might feel the pelvic floor move away from the chair. The pelvic floor is a smaller group of muscles and it's much harder to feel. So if you don't feel that movement, don't worry about it just now. Okay, now we're going to move on to the side of the canister, the transverse abdominal muscles. These guys are the deepest layer of the abdominals and form a corset around the trunk. The transverse abdominal muscles are our pull-it-in muscles. These guys get the most stretched out during pregnancy and sometimes take a hiatus afterwards and don't come back very well, and so need some training to help work again. So we're going to practice this as it relates to our breath again, because remember, we're trying to get the whole core canister to work together. So I want you to think about doing a nice inhale, and then as you exhale, think about drawing your belly in towards your back or drawing your belly away from your pants. You should be able to draw in and talk while you hold. It shouldn't be a big suck in and hold your breath. That just pressurizes the system. It doesn't have us use those muscles in a very good way. But many people, when they think about recruiting the transverse abdominal muscles or any abdominal muscles, think about sucking it in, and they suck in their breath and the belly at the same time. And although we're doing a little bit of muscle work, we are pressurizing the system by holding our breath and holding everything tense. And that pressure can feel really, really stable. So think of, if we use the analogy of a soda can, think of that closed soda can. The walls of the soda can aren't really that strong, but you can't crush a closed soda can because there's all this pressure pushing out on the inside. That's what happens when we do a big suck in of breath and hold everything. We get pressurized, which feels stable, but we're not really using our muscles as effectively. So to more effectively recruit those deep abdominal muscles, we do that nice inhale, and then as I exhale, I draw my belly in towards my back, away from my pants, and I should be able to talk while I hold it. So let's try that again, where we inhale, we're relaxed. Exhale, we tighten, and count out loud. 1, 2, 3. Let it all relax. Were you able to hold it the whole 3 seconds? Were you able to count out loud? Did you feel like you didn't have that contraction there at all? These are all questions that you may want to think about answering. If you were having trouble doing this in a sitting position, again, I recommend trying to do this laying down to see if you can feel that contraction happen a little bit better. Okay, so we talked about the diaphragm at the top, the pelvic floor at the bottom, and the sides of the canister with the abs. Now it's time to coordinate it all together into one movement where we're contracting our pelvic floor, our abs as we breathe out. So for many people, this is like, what is it, patting your head and rubbing your belly or walking and chewing gum at the same time. This can feel really, really challenging. If that is the case, you are not alone. This is some of the most common stuff that we are working with our pelvic health clients on here in our practice. So many, many people need help kind of working on this coordination. So don't feel alone if you're having trouble with this. Instead, it should just be a sign that you may want to think about partnering with a pelvic physical therapist. So to coordinate this all together, I want you to almost think about like we're zippering things up. Like you have a zipper that goes from either your anus all the way up to your belly button or from your vagina to your belly button. And that as we exhale, we're zipping that zipper up. So the pelvic floor goes up and the belly pulls in to zipper everything up and kind of have that support there. So we inhale, relax, exhale. Draw the pelvic floor up and the belly in. I'm holding mine right now. You should be able to talk. And then I let it go. Okay, so let's try that again. Inhale, relax. Exhale, pelvic floor in, belly in. Count 1, 2, 3. Let it all go. Were you able to hold for the 3 seconds? Did you feel your belly and your pelvic floor both contracting? Did you feel yourself want to hold your breath or suck everything in at the same time? If you had trouble doing this, again, you might want to think about partnering with a pelvic physical therapist to help make sure you're recruiting things the correct way to then be able to strengthen and support your pelvic needs. So once we get this connection down where I exhale and I engage my belly and my pelvic floor, what can we do throughout our day to continue practicing this recruitment of the core canister? And the answer is there are a lot of things that you can do. So when you lift something, you can do what we call exhale with exertion. So if I'm going to lift up something heavy like the laundry basket or a bunch of groceries out of the car or my kiddo or the stroller, anything that's got some weight to it, I want to think about exhaling as I exert, because right now, remember, we're trying to train our muscles that as we exhale, we recruit our belly and our pelvic floor muscles. So they pull in to give us support as we exhale. The exhale also serves as another purpose. Remember, if we go back to that soda can analogy, that we don't want to pressurize and push everything out on the soda can, because when we do that, can put a lot of pressure down through the pelvic floor. When we exhale, it's like popping the top on the soda can. It's letting pressure out our mouth. So it takes some of the pressure off of our pelvic floor, and that helps take the pressure away, as well as us recruiting those muscles and lifting up and in can help to create better support there to maybe help prevent bladder leakage from happening. So anytime you're lifting something heavier, I want you to think about exhaling with exertion. We can take that a step further from when we're lifting ourselves up out of a chair. So when we go from sit to stand, we are lifting our entire body weight up. And so you want to think about exhaling as you stand up versus doing that kind of breath hold of and straining through it. You want to blow out as you stand up. Another way to practice is if you have warning that a cough or sneeze is about to happen, I want you to try and do what's called the knack, or squeeze before you sneeze. So if you have warning that a cough or sneeze is about to happen, stop in place and think about pulling the pelvic floor muscles up and in. This just helps you to brace ahead of time. It gets those muscles ready to accept the pressure that's about to happen from that sneeze or that cough. So trying to do the knack or squeeze before you sneeze can help prevent that leakage from happening. Now, these core canister muscle recruitments should be an automatic thing that our body is doing, but like I've talked about previously, especially if there's been extra stress and strain, trauma to the area, pregnancy, delivery, surgeries, you name it, these muscles might not be coordinating together the way they are supposed to be, and they might be weaker than they need to be. And so this is us trying to retrain them to work the way we need them to train.
Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.